Welcome to Have More Babies.
Great to be here.
Today we're exploring a topic that, well, it often takes people by surprise. Juvenile arthritis.
Mm-hmm.
We hear arthritis and we almost always think of older adults, wear and tear,
Uh-huh.
that sort of thing, right?
That's the common picture, definitely.
But what happens when it's a child dealing with that kind of joint pain, the
Yeah.
swelling, the stiffness? That's what we want to get into today.
Yeah, it's a really important area.
And we're drawing our information for this discussion from a great article over on omegapediatrics.com. It's called Juvenile Arthritis, Navigating Childhood Joint Pain.
A very useful resource.
Our goal really is just to give you a clear picture of what this condition is about, covered the key facts, maybe some things you didn't expect so you feel informed.
Absolutely.
Okay, let's unpack this. So starting right at the basics, juvenile arthritis. It's definitely not just, growing pains, is it?
Oh, not at all. That's a crucial distinction to make right away.
So what is it then exactly? Who does it actually affect?
Well, juvenile arthritis, or JA, isn't just one single disease. It's more of an umbrella term.
An umbrella term. Okay.
Yeah, it covers several different types of arthritis that can affect kids, specifically anyone aged 16 or younger.
16 or younger. Wow.
And the core issue, the common thread through all these types, is chronic inflammation of the joints.
Inflammation. Okay.
Think pain, swelling, stiffness that doesn't just go away. And what's really fascinating, or maybe complex, is how it compares to adult arthritis.
How so?
While some mechanisms might seem similar, the way it presents in kids, the types, even the long-term effects can be quite distinct.
So it's its own beast, really.
In many ways, yes. The underlying problem is the immune system getting confused.
Confused.
Yeah, it mistakenly targets the body's own healthy joint tissues as if they were, say, a virus or bacteria.
Ah, so the body's kind of attacking itself.
Exactly. That immune response causes the inflammation, leading to those symptoms, the pain, the swelling. It's an ongoing internal process, not just a temporary ache.
That idea of the body turning on itself, that's pretty intense. Which brings us to the big question. Why? What makes this happen? The article mentions the exact cause often isn't known, which, must be incredibly hard for parents.
It absolutely is. That uncertainty is tough.
Mm-hmm.
But while we can't always pinpoint one single cause, we do know about contributing factors.
Okay, like what? What are the main suspects?
The article highlights three main areas researchers look at. First off, genetics.
So it runs in families sometimes.
Sort of. It's not like there's one arthritis gene, but having a family history of autoimmune conditions can make a child more susceptible. Like the genetic groundwork is there.
Okay, predisposition makes sense. What else?
Second, environmental triggers seem to play a role.
Like what kind of triggers?
Things like certain infections, maybe even physical trauma in some cases. The idea is that for a child with that genetic susceptibility, an environmental event might sort of flip the switch.
It activates the process.
Exactly. It kicks that predisposed immune system into overdrive against the joints. And the third factor is the immune system dysfunction itself.
Right, the body attacking itself part.
Yeah, it's this complex breakdown where the body's defense mechanism just keeps attacking healthy tissue. It's not a one-off mistake. It's a sustained faulty response causing that chronic inflammation.
Okay, wow. So genetics, environment, and the immune system going haywire, that's quite a combination.
It is.
And here's where it gets really interesting for parents, I think. If it's more than growing pains, what are the signs? Beyond the obvious sore knee or elbow, what else should people be looking for? Maybe things that are easy to miss.
That's such an important question because spotting it early makes a huge difference, and some signs aren't obviously joint-related.
Like what?
Well, besides the joint pain and maybe visible swelling, a really common one, a classic sign, is morning stiffness.
Morning stiffness.
Yeah, significant trouble moving joints, feeling really stiff, especially right after waking up or even after sitting still for a while, like during a nap or a long car ride.
So a kid might seem really slow or reluctant to get moving in the morning.
Exactly. It might take them a while to kind of loosen up. It's more than just being a bit groggy.
Mm-hmm.
And then there are more general symptoms,
Mm-hmm.
things like a persistent low-grade fever that you can't explain, or just ongoing fatigue, feeling generally unwell.
Which could easily be mistaken for like a virus or just being tired.
Precisely. And another surprising one the article mentions is rashes.
Rashes. Really? Like on the skin?
Yes, certain types of unexplained skin rashes can actually accompany juvenile arthritis. Not something most people would connect to joint problems at all.
No kidding. So it really highlights why you need to look at the whole picture, doesn't it?
Absolutely. It's crucial to look beyond just the joints themselves.
Okay, so If a parent is seeing some of these signs, the stiffness, the fever, maybe even a rash, along with joint complaints, what happens next? How do doctors actually figure out if it is juvenile arthritis? It sounds tricky to diagnose.
It requires a careful approach, definitely. It's often a process of elimination, too, ruling out other things.
Yeah.
Usually, it involves a few key steps, often with a specialist, a pediatric rheumatologist.
Okay.
First, they'll take a really thorough medical history.
Talking about symptoms, family history.
Exactly. When did symptoms start? How have they changed? Any illnesses? And yes, very importantly, any family history of autoimmune conditions.
Right.
Then comes a detailed physical examination. The doctor will carefully check the joints, looking for warmth, tenderness, swelling, seeing how well the child can move them, their range of motion.
Okay.
And finally, there are tests. Blood tests and imaging are usually needed.
What do blood tests show?
They can look for signs of inflammation in the body or sometimes specific antibodies linked to autoimmune issues. Though it's important to know there isn't one single blood test that says, yes, it's JA.
Okay, so it's part of the puzzle.
Exactly. And imaging, like X-rays or maybe an MRI, can help see if there's joint damage or inflammation inside the joint. These tests help confirm JA, but also, crucially, rule out other conditions.
Like infections or other things that might cause similar symptoms.
Precisely. Infections, other rheumatic diseases, even sometimes, rarely, things like leukemia can cause joint pain. So ruling those out is a critical part of the diagnostic journey.
Wow, okay. It's a really systematic process. And so once they do confirm it's juvenile arthritis, what's the plan? The article talks about a holistic approach. What does that actually involve for a child?
That holistic approach is key, especially for kids. It means looking beyond just the joints and treating the whole child to improve their overall quality of life.
Right, not just managing pain.
Exactly. It's about enabling them to live as full life as possible. Treatment usually involves several strategies working together. Medication is often a cornerstone.
What kind of medication?
Things like anti-inflammatory drugs, NSAIDs, maybe corticosteroids short-term to bring down pain and swelling quickly. But often, more specialized drugs called immunosuppressants or biologics are needed.
To calm down that overactive immune system.
Precisely. They target the underlying immune dysfunction to reduce inflammation and, really importantly, help prevent long-term joint damage.
Okay. What else besides meds?
Physical therapy is hugely important.
Exercises.
Yes, but very specific, tailored exercises. They work on improving joint function, maintaining flexibility, increasing range of motion, and strengthening the muscles around the joints for better support.
So it helps them keep moving better.
Absolutely. And it powers the child, too. And the third piece is lifestyle.
Like diet and exercise.
Yeah, the article mentions the role of a balanced diet and appropriate physical activity. Not necessarily intense sports during flare-ups, but regular movement helps maintain joint health and overall well-being. Managing weight is also important to reduce stress on joints.
So it's this combination, meds, therapy, lifestyle adjustments.
Right. It's a multi-pronged approach tailored to each child.
So bringing all that together, what does this actually mean for a kid's day-to-day life? It sounds like a lot to manage physically, but it's more than that, isn't it? The article mentioned the emotional side.
Oh, absolutely. We can't overlook the emotional impact. That's a huge part of the holistic picture.
How does living with JA affect a child emotionally and, like, their friendships in school life?
It can be incredibly tough. Imagine dealing with chronic pain or fatigue or maybe visible swelling when you're just trying to fit in. It can really hit a child's self-esteem.
Yeah, I can see that. Feeling different.
Exactly. They might not be able to keep up with peers in activities, or they might feel self-conscious about their condition or needing medication. And social interactions can suffer too.
How so?
They might miss school, struggle to participate in play, maybe face misunderstandings, or even bullying from other kids who don't get it. This can lead to feelings of isolation, anxiety, or even depression.
That's heartbreaking. So support is crucial then.
Absolutely vital. The article really stresses the need for emotional and psychological support right alongside the medical treatments.
What kind of support helps?
Things like counseling for the child and family, support groups where they can connect with others going through similar experiences, educating teachers and classmates. It's about building a strong support network.
So addressing the emotional side is just as important as the physical.
Every bit as important. For a child's overall development and well-being, you have to address both.
That makes total sense. So looking down the road, what's the long-term picture for kids with JA? Is there a cure? What can families expect?
It's important to be realistic, but also hopeful. Currently, as the article states, there isn't a definitive cure for juvenile arthritis.
Okay.
But, and this is big, but advances in treatment have been really significant. Many, many children with JA can achieve remission.
Remission, meaning the disease goes inactive.
Exactly. Disease activity is very low or completely absent. With effective management, the right medications, ongoing therapy, lifestyle adaptations, many kids go on to lead very full, active, productive lives.
That's really good to hear.
Yes. The goal is to control the inflammation, prevent joint damage, and maintain function. While it might be a lifelong condition to manage for some, the outlook today is vastly better than it used to be. It requires ongoing care and adapting, but kids can definitely thrive.
That's a really positive and important message. Okay, so let's try to wrap this up. Juvenile arthritis. It's clearly a serious, complex condition in kids, way more than just growing pains.
Definitely.
It affects them physically, emotionally, socially, but understanding the symptoms, especially the less obvious ones like morning stiffness or rashes, getting that careful diagnosis, and then embracing that comprehensive, holistic treatment, it makes a huge difference.
A world of difference.
An early intervention, plus that ongoing support for the child and the family seems absolutely key.
Couldn't agree more.
So if you're listening and you, or maybe someone you know, has concerns about juvenile arthritis or really any pediatric health issue, we definitely recommend checking out omegapediatrics.com.
Great resource.
They have expert advice, lots of in-depth information, and really compassionate guidance on this topic and many others related to children's health.
Yes, very thorough.
And importantly, you can also book an appointment directly through their website if you need personalized care or want to talk to a specialist.
That direct access is really helpful.
Definitely. And if you found this conversation helpful today, please do take a second to like this video, subscribe to our channel so you don't miss future discussions, and maybe share it with anyone who might find this information useful.
Your support really does help.
It really does.
Maybe a final thought. Consider just how critical it is, not only to recognize those physical signs of illness in children, but also to really tune in to the unseen emotional burdens they might be carrying. Supporting both aspects. That's where true healing happens.
That's a powerful point to end on. Thank you for joining us today on Have More Babies.